everybody. This is Dr. Paulette, and I'm back to continue the conversation about Minority Mental Health Awareness Month. And it's interesting that since I've been doing this post this month to try to increase awareness about not only the issues that are prevalent within minority communities and the stigma attached to Mental Health Awareness Month, I also have had a few friends on Facebook because I've been posting across social media platforms. I have friends on my Facebook page that, of course, are not in the minority group, but a couple of them have inboxed me and asked a similar question. And the question is, although I'm not minority, can I also have a mental health month, or can I be aware of mental health this month? And I'm like, absolutely. As a matter of fact, you should be having a mental health day every day. And so I took that opportunity to educate about why Minority Mental Health Month was established in the first place. And it was established to increase awareness, to identify the disparities, because also, although there's been a growth in addressing mental health nationwide, there are still gross disparities amongst minority communities, specifically lack of access, not understanding what mental health is, not understanding how to access services that are available, and all of those other issues, funding and resources not being dedicated to lower income areas, all of those things that come into play: prejudice, discrimination, microaggressions, lack of cultural competency when minorities do seek services from mainstream providers. And then some of the statistics that also come into play in studies that have been done. And so I want to read a few things because I think it's very important to highlight that, to continue to reinforce the importance of this. And according to SAMHSA, over 70% of Black African American adolescents with a major depressive episode did not receive treatment for their condition. How is that? Almost 25% of adolescents with a major depressive episode in the last year were Hispanic or Latino. Asian Americans were less likely to use mental health services than any other racial or ethnic group. In the past year, nearly 1 in 10 American Indian or Alaska Native young adults have had serious thoughts of suicide. And in the past year, 1 in 7 Native Hawaiian and Pacific Islanders adults have had a diagnosable mental health illness. But it wasn't through them seeking services. It was because of other issues that had come on, or the behaviors that had manifested, and they went to their doctors, and subsequently the process happened for them to be diagnosed. So that's the purpose and the reason that we're highlighting some of the disparities that are happening, or that happening, and why the month was established in the first place. But let's talk about what do we do? What are we doing right now? What understanding are we bringing to the table to make sure that we understand what the issues are? And according to, again, the National Institute of Mental Health, 1 in 5 43 million Americans suffer from a mental illness. 1 in 25 are seriously impaired. But of that, studies have shown that there's a 20% higher increase of African Americans that are diagnosed as opposed to Caucasians. But here's the deal. Sometimes they're misdiagnosed. Sometimes their anger is misconstrued for something else, and they receive a mental health diagnosis when there's actually something else going on. And again, that's because of lack of cultural competence and providers not understanding or getting the full picture. So not only are there disparities where we have lack of access to services, we also have a gross number or population of minorities that often get misdiagnosed or labeled with a mental health illness that isn't there. And so the problem is that continues to create mistrust and individuals being reluctant to seek services because of that history of, again, being exploited, the mixed diagnosis that happen, and all of those things that occur that actually harm the individuals that seeking services more often than it does help. And so what are some of the things that we need to do, or you need to do, if you suspect that you have a mental health illness? Because especially for the African American community, we have a tendency to go to the church. And please don't get me wrong. I've said this before. I believe in the power of prayer. I have an active spiritual life. But what happens when prayer isn't enough? Faith without works is dead. And so, back to that story that I talked about in a previous clip where little Karen, things happened between little Karen because she got left alone with the uncle that the rest of the family knew not to let him babysit. And then little Karen is silenced, and she grows up angry and confused and promiscuous, and she gets into drugs and alcohol, and she goes into adult life, living this chaotic life. And the whole time little Karen was told she should pray. And so little Karen did pray. And she prayed and she prayed and she prayed. And then she ends up in my office seeking services because she prayed and she prayed and she prayed. But the pain didn't go away. The guilt and the shame associated didn't go away. And all of those other things that she sought out trying to alleviate the pain and the shame and the the silence that she had, because she didn't have anybody else to talk to about it. So she turned to drugs and alcohol and was promiscuous, and all these other things happened to her. And she comes to my office broken because she doesn't know what else to do. She's on the edge of even wanting to live. And she prayed and she prayed and she prayed, and she doesn't understand why God didn't answer her. She doesn't understand why God forgot about her, or she's given up on God, that God is mad at her. I can't tell you how many times I've had those type of conversations with individuals that were told to just get over it, or we don't talk about that, or was shamed because they wanted to seek services, or nobody bothered to get them help. So I'm not saying that going to the church is definitely an aspect of life. Mind, body, and spirit are connected, and you definitely need to have a healthy spiritual life. But I think we need to go a step further in making sure that individuals understand that, and that we make sure that we provide them the proper services that they need in accordance to what they need, not what you think they need. And so what does that look like? What does that look like when you're looking for services? When you finally come to the determination that you or a loved one needs to seek services outside of just talking to your girlfriends, outside of just hanging out with your boys, outside of being a workaholic, and when the drugs and the alcohol no longer work and they don't quite numb the pain the way that they used to, what do? First of all, the first step is educating yourself and making sure that you understand the signs and symptoms of mental health illnesses. And I will be doing a clip where I'll just be doing a broad overview of some of the signs and symptoms. And then educating yourself about treatment options and what treatment options are available. Do you want to take medication? Should you take medication? What does a medication do? It's also important to know that for some minorities, specifically Asian and African American minorities, our bodies don't always metabolize medication in the same way that our Caucasian counterparts do. And so sometimes we get discouraged from taking medication because of the side effects, or it may take longer to take effect. And so then the medication isn't taken as prescribed. Talking more openly and consistently, you will continue to hear me talking about, let's have conversations about mental health so that we can normalize the conversations about mental health, and it be just as normal in saying that I'm suffering from depression as it would be me saying I have high blood pressure. Create a stress management and diet and exercise program. How do you handle stress? What do you do when you're having a bad day, and understanding the difference between you having a bad day and when it's when you're having bipolar symptoms as opposed to depressive symptoms, or if it is an anxiety, those kind of things. Join or start a support group. If you can't find a group of people that are suffering from similar things that you're suffering from, start your own. Start your own with friends and family, and dealing with loved ones, especially if you have a loved one that you're trying to help deal with a mental illness. Seek professional help from a competent provider. What does that mean? You should be interviewing your therapist. When you go to seek services from a psychologist, from a counselor, from whomever you're seeking services from, and you're going to be telling them and revealing things to them that you haven't told anybody, you need to make sure that you interview that therapist. And if that therapist has a problem with you asking what their credentials are, what their experience is, how have they helped others with problems similar to yours, how can they help you, what's their process, what's their framework, how do they proceed in helping you with treatment, and what are their beliefs about the mind, body, and spirit, if that's important to you. Whatever questions that you need to ask, if that therapist has a problem with answering those questions or having that conversation with you, you need to leave. Just like you would continue to look for a doctor that can help you with a physical ailment, you need to make sure that your therapist can help you with your mental illness. One size doesn't fit all, and just because you have a license doesn't mean you're necessarily qualified to help, or that therapist is necessarily qualified to help you with what you need. Interview your therapist, ask those questions, and make sure that you're comfortable. And then as you proceed in developing a plan with that therapist or that counselor, whomever it is that you choose to seek out to help you, it should be a collaboration on how you move forward with resolving whatever issues brought you to the office. It should be a collaboration. It should never be just the therapist telling you what you need and what you need to do. So those are the things that those are just the basic broad over things that you should be asking, and you should be seeking, and you should be knowing. But how do you know when you're suffering from a mental health illness? And how do you begin to determine if you or a loved one is just having a bad day or just going through a rough patch in life? Because we all have ups and downs, and hot valleys and lows, and those kind of things. So how do you determine if they're just having a bad day, or they're just going through a rough patch in life, or if there's really something going on? So depending on the type of mental illness, and again, it's very broad, which is also why you should seek services. And sometimes it's just to make sure that you rule things out. Depending on the type of mental illness, there may be a number of signs: depression, chronic pain, increased risky behavior, substance abuse, promiscuity, decreased sex drive, increased sex drive, aggressive behavior, mood swings. All of those things can come into play. And so if you start to see a pattern of any or all of those things happening, seek help. How do you access? You can go to your primary care doctor. There's community support centers that provide mental health services. You can call, if you have insurance, you can call your insurance company. They will help you find a mental health provider. And you can also go to the different websites. The Department of Health and Human Services has links to hotlines and list of hotlines and websites that you can go to and actually call somebody and talk to them about mental health services and helping you find mental health services in your area. So this isn't a one size fit all. This isn't a prescription that I can just give you a prescription and it's going to fit every situation and every scenario and every person. You have to take upon yourself to learn what it is, and then be willing to advocate and seek services and speak up for the things that you or a family member or a loved one may need. As I've said before, when we do better, we know better. So let's start doing better.